And we've got to get away from the concept of the human body as a machine and turn it into an awareness that it's a biological, living, breathing organism that is an emotional reality, a mental reality, and is part of a collective whole or a spiritual reality, and deal with people physically, emotionally, and mentally, because most of these problems actually are the results, as I said, of belief systems, which is a mental construct, which then instills the values through programming. And if you study Jungian psychology, there's 4 functions to consciousness: thinking, feeling, sensation, and intuition. And the feeling function of consciousness is where our emotions come from. And so what it means is that our sense of feeling is based on our values. What we feel good about usually is something that's in harmony with our values. If we're being a good Christian, we're happy, but if we're sinning, we're not. If we're being good, it usually means we're in alignment with the stated values of the belief system we're in. For example, if in our culture, if you go to the store and there's a line to get to the cash register, you don't cut in line. You go to the end of the line and wait your turn. But in China, they believe if however you can get in there, you get in there. So they'll stomp all over each other. But if someone cuts in line, people will get very angry because a value has been trespassed. So when we really realize that a lot of our emotions come from trespass of values or alignment of values, then we have to realize that we have to change our values about what it means to be healthy and what it means to get healthy and what it means to be a therapist and what it means to be a doctor, which means we have to go out of the value that we pay money to get fixed and out of the value that people are machines that we tinker with, like we tinker with engines and airplanes, to the value that people are living, breathing organisms that have thoughts, feelings, emotions, and relationships. And it's usually their thoughts, feelings, emotions, and relationships that produce the stress that manifests as physical dysfunction. And therefore, if we're treating the physical body, we're treating the end product of a chain of events that begins with a mental construct or a belief. So until we actually turn health into an integrated system where people have not only the training in anatomy and physiology, but have a basic understanding of emotions, relationships, psychology, and it's very important to study belief systems. And the most common belief systems are the world religions. So I spent years studying world religion and comparative religion and philosophy and psychology so that I can understand how a person comes to create a belief and what is the power of a belief system for better or worse. And I found probably in 98% of the cases that I could not help people resolve chronic pain and disease unless I went directly to the belief system, which is the source of the behaviors that led to the choices that produced the obesity, the metabolic syndrome, the leaky gut syndrome, the chronic knee dysfunction. Look, I work with a lot of the best athletes in the world. And having seen thousands of cases like this, 98% of them that have gone to doctors and therapists have never had anyone evaluate their lifting technique, their running gait, or anything that is a mechanical force that led to an injury of a mechanical nature. I saw this with professional athletes coming into the physical therapy clinic. They would just treat them after surgery or centralized discs and use stretch bands and pink dumbbells. And the next thing you know, the guy's on the line of the San Diego Chargers football team about to get his head knocked off by a 280-pound monster. But just yesterday, he could only lift pink dumbbells and stretch cords. So they had no means of progressing people back into authentic athletic conditioning and have no knowledge of the science of athletic conditioning or anything beyond pure isolated rehabilitative exercise, which are all based paradoxically on a bodybuilding isolationist model, which isn't even how the body works. So really what I did in my life is I went through an analysis and studied comparative diagnosis. So basically books looking at what kinds of things can be caused by other things. So what are 10 different systems in the body that can cause a headache? What are 10 different things that can cause pain in a woman's uterus or lead to uterine fibroids? And the books are on differential diagnosis is what they're called. And I started looking for these things and found, oh my God, probably half of my clients, actually the etiology of their problem is in a system completely in another zip code as far as the medical system's concerned. And for example, I would get chewed out by doctors and therapists for correcting the position of the atlas when people had low back pain and pelvic girdle pain. And they would say, what the hell are you doing? You did not get a prescription to touch their neck. You're only supposed to touch their back. And I would have to break out an anatomy book and show them the cord tracts of the spinal cord, the denticulate ligaments, show them what the research on the atlas shows, show them that when the atlas is subluxed as little as 1 degree, it can cause traction on the denticulate ligaments, which attach right to the cord tracts that control the lumbosacral region in the descending corticospinal tracts, and even in the ascending pyramidal tract. So it would disrupt the proprioception and the motor control. And also they forget that every single nerve in your body passes through the atlas. So if you have an atlas axis dysfunction, and it's the most commonly subluxed joint in the human spine, it's got the most range of motion and the least ligamentous support. And so when I would be fixing people without ever touching their backs or their necks, I would be getting ridiculed and attacked by doctors right in front of the patients. And I would turn and smile and say to the patient, how many visits did you have to see me to get better? 4. How do you feel? Better than I've ever felt before. Mm-hmm. Okay, doctor, wasn't that why they came here in the first place? So don't you really have an interest in how I did that? And by the way, I learned that by studying anatomy books. I did 5 cadaver dissections so I could really learn anatomy. And I found most doctors don't have any knowledge of anatomy outside what they operate on. They certainly have very little understanding of the integration of biological systems such as circulatory, lymphatic, digestive, eliminative. Mm-hmm. And so they're so highly specialized that they're really quite blind. And the human body is a fully integrated system, not only the physical elements, but the emotional, mental, and therefore spiritual components of it. So what I'm saying is that we now have an opportunity to really celebrate. I tell my students all the time, don't ever be stupid enough to think that you now know enough to stop studying, because the human body is as complex as the universe. In fact, it takes an entire universe to make a human body. You will need to be committed to observing carefully and studying for the rest of your life, and know that every patient that ever comes your way is a gift from the universe to teach you something. So the day you start treating people as objects and not paying attention and listening carefully for the gifts that they're bringing you, you have started to mold